Hi, and welcome to this presentation on Madeline Leininger by Group C. For the introduction on Madeline Leininger, she was born in July 13th, 1925 in Nebraska, and she grew up on a farm with four siblings. She, in her early life, watched her aunt suffer through a congenital heart disease, which influenced her to pursue her nursing education at St. Anthony's Hospital School of Nursing. And she got a bachelor's in biological sciences, nursing administration, teaching curriculum, a master's in nursing, and a doctorate in cultural and social anthropology. She actually pursued the Cadet Peace Corps with her sister while pursuing her nursing degree. And she held numerous positions at different universities. And according to AI, she had learned a lot about different diverse backgrounds growing up. And with her background in nursing, she wanted to have a deep-seated interest in caring for others. So a little about her orientation. Her work was really shaped by her time and the context of what was going on, including the civil rights movement in the 1950s and 1960s, the Vietnam War from 1955, to 1975, and various healthcare reforms, which include the establishment of Medicare and Medicaid. And this was important as it highlighted disparities of different cultures and socioeconomic groups. Also, during the Vietnam War, it really opened up Madeline to the need for cultural sensitivity. And the civil rights movement helped influence her to this role of transcultural nursing that really shaped her career. She's best known for the development of of theory of cultural care. And the theory of cultural care included 5 roles of culture in nursing. And this included cultural care theory, transcultural nursing, holistic perspective, care as central, and cultural diversity and universality. Her physiological orientation was deeply influenced by the political, social, and cultural changes in her era. And her focus on the nursing was a response to the growing recognition of cultural diversity and the need for more cultural sensitive practices. Chat GPT was the AI technology that we utilized for this project. This really captured Leininger's philosophical orientation. The AI tools aim to reflect and implement importance of cultural understanding and sensitivity that Leininger championed during her era. It has also increasingly aligned with her philosophical orientation by incorporating her principles of cultural care into various aspects of health care, including AI educational tools, patient interactive models, and AI translation services. So more on her experiences and contributions. So again, transcultural nursing is really the core of what she did. And it is the study of cultures to understand both similarities and differences in patient groups. Nurses have the duty to to fully understand the scope of a patient's culture has on their health. She also developed the Sunrise model, which is a visual tool that helps nurses understand how culture impacts their healthcare. She experienced caring for Native Americans and immigrant populations in the United States. And she was also a world traveler, and she studied health practices in other countries like New Guinea. And AI gave a lot of insight on her experiences throughout her travels around the world. And certain groups were not studied due to, in part, that these communities are not seen as having a culture. And just expanding on the sunrise model, it teaches three key parts, including understanding and adapting to the cultural necessities of the patient, considering the factors that play into healthcare among those with cultural, and improving better treatment outcomes for patients based on cultural congruence. Some limitations that we found in AI and scholarly works. The strengths are that it creates the ability to automate and accelerate research processes. It saves time by allowing researchers to focus on higher level tasks such as critical analysis. It helps assist with brainstorming, and it helps ensure grammar and citations are accurate. Some weaknesses include AI system relying on patterns and statistical correlations. They cannot synthesize complex ideas or use critical thinking. And this is really critical as nurses because our career and our thinking and every decision we make is based on critical thinking. It's also has an issue because sometimes the generated data can often contain bias. It can also have a lack of originality in writing, and it's not as creative as somebody who is actually writing it themselves. AI outputs are only as good as the data it has access to, which may be outdated, leading to incomplete or false information. Critical analysis. Pioneer transcultural nursing includes and emphasize the importance of cultural competence in nursing care, advocating for culturally consistent care, and nurses should be considered patients' cultural beliefs and practices. Some more importance of the transcultural nursing includes improved patient outcomes. It promotes cultural competence among nurses and healthcare professionals. So this goes even beyond nurses and into physicians and advanced care providers as well. It enhances holistic care by focusing on the whole person, and it considers not only their physical health, but also their cultural and emotional well-being. Cultural care theory promotes the idea of universal care values alongside cultural specific practices. It encourages holistic nursing. The focus here is care, not cure, as the essence of nursing, which is very important. And importance of cultural care theory. Leininger emphasized that the main goal of nursing should be focused on care, not the cure of the patient. These practices are followed in present date and have great influences on the role of nurses in healthcare setting. Again, she focused on the care, not the cure, as the essence of nursing. When doing a comparative analysis between AI-generated information and existing scholarly literature, this is what was found. While AI provides meaningful insight on Leininger's background, contributions, and legacy, it is important to use AI tools with caution. AI engines are only as good as the prompts and guidance they are given, so it is important to phrase questions appropriately. After competing our research and comparing with the AI generated information, We found that it was fairly relevant and accurate as we were able to verify information across other scholarly sources. Scholarly sources should still be the primary source of information for extensive projects on Leininger's work. But AI provides excellent insight that can be used to grasp the fundamental concepts pioneered by Leininger. So, in conclusion, the AI interview highlighted Madeline Leininger's accomplishments, consistently connecting them to why she became a nurse she was. Growing up in the Great Depression and World War II contributed to her understandings of cultural diversity, which drove her to confront challenges like cultural barriers in healthcare, gender bias, and how reluctant it is to change it during that time. These obstacles led her to pursue a PhD in anthropology, allowing her to merge cultural awareness with nursing. The interview emphasized her legacy, particularly the development of the Sunrise model and her efforts to bridge cultural gaps in healthcare. Her passion for helping underserved populations receive better care was a prominent theme in her work. Leininger's leadership in academic institutions established her as a key figure in nursing, and it influenced future generations to also incorporate cultural competence in healthcare. For our group reflection, some learning points that we found was that AI can be incorporated into our future practice. AI can also help communicate with diverse populations with using AI translation models that can help communicate with patients who speak different languages. Some limitations of AI include AI does not replace the complex critical thinking of a nurse. AI does not have complex critical thinking of a nurse, and it's important that we fully do not rely on AI and that we're always critically thinking. Another limitation is that AI is not always accurate, and information that is produced must be verified. We must still use our critical thinking to make sure the accuracy and the validity of the information that is produced by AI. AI in the future of nursing practice for us will include being used in future practice. Many providers have already begun to use AI in their hospitals, and the usage of it in different departments and different hospitals will only keep growing. AI might have disclosure dilemmas, as a patient might not fully be aware of the usage of AI in their patient charting, and this might raise many concerns for patients. And another issue that might come in the future of nursing practice while using AI is that patients might be concerned about AI being used, and a lot of patients might not even know what AI is. And here is our group collaboration. And our references. We utilize ChatGPT for OpenAI for this project. Thank you for enjoying this presentation.